Hello, everybody, and welcome to this week's episode of Medisodes. This week on Medisodes, we're going to be discussing the idea of blood donation. Now, blood donation is a key thing that sustains many of the health systems around the world. A lot of medical procedures end up causing a lot of damage during the process, or there are people who come into the hospital who are heavily bleeding, and the only way these people can be saved is through donated blood. But how is blood donated? How do they process it, collect it, and give it to the patients who need it the most? And how is this different around the world? And are there any dangers of this current system? We're going to go through all of that and more in today's episode. And we're going to start off with how the donation process works. As many countries as possible try and simplify the donation process, which makes it more likely that more people will donate. In the UK, which we'll be using as our example for this section, the whole process takes around an hour. As people arrive to donate blood, they're given 500 milliliters of fluid, which they're advised to drink over 5 minutes as they read a donor consent booklet. The fluid aims to make sure that they have good well-being during and after donation, as obviously they'll be draining some of their blood. They also do a health screening at the point of donation, just to make sure that they have correct iron levels and that they haven't misfilled out any forms to make sure their blood is safe to donate. The actual donation process includes attaching a cuff on the arm to maintain a small amount of pressure, and then an examination to find a suitable vein to insert the needle. It's also going to be cleaned with an antiseptic sponge. Once the needle's inserted, around 5 to 10 minutes of time will pass as 470 milliliters of blood is drained from the person's body. After that, the needle is removed and a sterile dressing is applied to the arm. Now, in 99% of cases, this shouldn't cause any different problems for the people who donate their blood. Afterwards, if they become unwell, there are follow-up checks, especially 2 weeks after the donation, especially to make sure that the blood is okay. But for most people, donating blood is just a simple in and out process. But the actual blood itself has a lot longer journey before it gets to a hospital or anywhere near patients. Blood first goes to a processing facility. It arrives in vehicles and in large plastic bags. Each bag has samples, 3 from each donation. And the testing first begins with safety testing. First, they have to check the blood group of the blood, not only the ABO, but also the blood's rhesus factor. Then they screen for diseases, syphilis, HIV, hepatitis, and first-time donors are also tested for the human lymphotrophic virus, because this can cause leukemia. In other situations, they test for other things. For example, some donors that have tattoos have a 4-month deferral so they can test for diseases such as malaria, Chagas' disease, West Nile virus, or others. All of this is to make sure that the blood is safe to donate. They don't want to give a sick person infected blood. And in fact, some of the biggest scandals in health history have been because infected blood has been given to patients. After this, white blood cells are removed from all the donations in a process called leukodepletion. This is because it is in the white blood cells that many infections travel. After leukodepletion, as the bags are being filtered, the white blood cells are filtered out and disposed of. Then the donation is separated into several useful products. Sometimes it will be separated into red blood cells, fresh frozen plasma, which can be used for burn victims and also just to replace lost blood volume, platelets for use in clotting and cancer patients, cryoprecipitate, also used to aid clotting, and leukodepleted whole blood, which is mainly used for infants and young children. All the donations are centrifuged to ensure complete separation of the different parts of blood, and all of these can be separated into different sections. There are other processes involved, such as pressing, freezing, filtration, and separation. However, specific details are closely protected by governments, as they need to make sure that the process cannot be compromised in any way. A lot of facilities that manage the donation and processing of blood also have quite strict security as well. Now, in a lot of countries, medicine is not free, and so these blood products that are separated have different prices. For example, A unit of standard red blood cells costs £124.46 in the UK. Plasma is cheaper, being only £28.75 a unit, whereas other products are much costlier. Some cryoprecipitates are £1,000 a unit. Plasma in particular has a separate processing, as it has to be frozen and kept that way until it's used, and only male plasma is used. The problem with female plasma is that it contains a lot of hormones caused by the menstrual cycle, and also antibodies produced by pregnant women, which can attack the lungs of anyone who receives their plasma, and therefore any female donors, their plasma is discarded. Finally, the blood products that survive this process are sent off to their destinations. This whole process takes around 24 hours from entering the processing facility and getting sent to the hospitals, and in this time it's carefully monitored to make sure it doesn't decay or start to break down. This process has to be as quick as possible because blood demand is very high in hospitals around the world, and as soon as the blood has been processed, it is sent immediately to whichever centre needs it the most. So now that we've talked about why blood is being donated and how it's Now that we've talked a bit about why blood is being donated and how it's processed, let's talk about who can actually donate blood. And for that, I'll hand over to Shrey.
When considering blood donors, we need to make sure that they are suitable for the task because giving blood can have some dangers, which we'll cover later. In England and the UK, the NHS eligibility for being a blood donor is that you have to be fit and healthy, between 50 and 158 kilograms. In old money, that's 7 stone, 12 pounds, and 25 stone. You have to be aged between 17 and 66, or this rises to 70 if you've given blood before, and those 70 plus can also give blood if they've given a full blood donation in the last 2 years. As Anupam mentioned, males are preferred because males can donate more often than women because they have higher iron levels. Men can donate every 12 weeks and women can donate every 16 weeks. And this means that men can have one extra donation per year. Men also don't have certain antibodies that women have, as Anupam mentioned, and this makes their blood products more useful. If you're considering being a blood donor, you should check the criteria for being a blood donor. For example, you shouldn't donate if you think you need to test for HIV/AIDS or hepatitis or the HCLV. You should also not donate if you've had PrEP or PEP, which are two drugs aimed at preventing HIV. You need to wait 3 months after you finish that medication. And unfortunately, some people can never donate blood. For example, if they're HIV positive or they're receiving treatment for HIV, if they're a carrier for hepatitis B or C, if they have the HCLV, and if they've ever had syphilis, even if it's been treated. This is obviously because we need to make sure that the people getting the blood, it's not got anything in it that might harm them. You should also check whether the medical and hospital treatments you've received, whether you've travelled outside the UK can also be a factor. Tattoos and piercings are you might have to wait a bit longer before you can give blood. If you're pregnant, that's also consideration. After pregnancy and during pregnancy, you need to check whether you're allowed to give blood. If you feel ill, you should also not give blood. If you have cancer, or if you have been receiving blood products or organs donations yourself. Even after blood is donated, certain blood can only be used with certain patients and received by certain people. And this is because of blood types and blood groups. Our blood cells have antigens on them. Different people have different antigens. 4 main blood types, so that's A, B, AB, and O. So, as the name suggests, people in blood group A have type A antigens, blood group B have B antigens, AB have both A and B antigens, and O don't have any antigens. As well as the different antigen types, you can also be positive or negative, and this is for something called rhesus factor, which is another thing found on the surface. So we look at who has what blood type. The most common is O positive, which is 35% of people. A positive is the second most with 30%. And if we look at the rarest, it's the AB blood types, both positive and negative, have 2% and 1% respectively. Depending on which blood type you have, it can affect who can receive your blood. So, for example, the O negative blood type is known as universal donor. And that's because this blood type does not have any antigens on it, and that means the body doesn't recognize it as foreign and it doesn't attack it. If we look at the A negative blood type, it's known as the universal platelet donor because of the people with A negative blood can give platelets to all. A B positive is also becoming a very important blood type because many people from South Asian and African descent who have high rates of sickle cell anemia need these blood types because they need to have regular blood transfusions. The NHS is calling for more people from Asian and African descent to donate blood because proportionally they're less than Caucasian. Looking at how much blood is needed, the NHS estimates that 400 new donors are needed every day, especially those with O negative and B positive blood, because these are the most useful. And in terms of how blood is delivered, so Anupam's mentioned how donors give blood, but blood transfusions work by delivery by intravenous. Blood is given intravenously, straight into the blood vessel of the patient, usually in the arm. If you look at what the blood is used for, 2/3 is used to treat medical conditions such as anemia, cancer, blood disorders, and these are, for example, platelets that stop bleeding. Many people on chemo need it to reduce blood loss, and also people have accidents, organ transplants, and surgery. Unfortunately, platelets only last for 7 days, so it's very important that these get replenished, the stocks of blood get replenished. And if we look at other things such as cancers and blood disorders, these are regular blood transfusions needed that need to be topped up. And the other third is surgery, emergencies, and childbirth. So obviously these aren't going to involve a lot of blood loss, but they're less because surgeries and these types of things are much more rarer. They're not as used, but perhaps when you think of blood transfusions, you are thinking about emergencies, childbirth, A&E, but actually 2/3 majority is being used to treat long-term health conditions such as anemia, cancer. Now we've talked about who can give blood and who can receive blood. Let's talk about the uses of blood in treatment and also its availability in different countries.
So now let us look at the statistics surrounding the availability and usage of blood. Starting off with looking at the statistics behind the availability of blood. Of the 118.5 million blood donations collected globally, 40% of these are collected in high-income countries, home to 16% of the world's population. In low-income countries, up to 54% of blood transfusions are given to children under 5 years of age, whereas in high-income countries, the most frequently transfused patient group is over 60 years of age, accounting for up to 75% of all transfusions. Based on samples of thousands of people, the blood donation rate is 31.5. Wait, let me do that sentence again. Based on samples of 1,000 people, the blood donation rate is 31.5 donations in high-income countries, 15.9 donations in upper-middle-income countries, 6.8 in low-middle-income countries, and 5 in low-income countries. And an increase of 7.8 million blood donations from voluntary unpaid donors has been reported from 2013 to 18. In total, 79 countries collect over 90% of their blood supply from the voluntary unpaid blood donors. However, 56 countries collect more than 50% of their blood supply from family or replacement or paid donors. Only 55 of the 171 reporting countries produce plasma-derived medical products, which are known as PDMPs, through the fractionation of plasma collected in the reported country. A total of 90 countries reported that all PDMPs are imported. 16 countries reported that no PDMPs were used during the reporting period, and 10 countries did not respond to the question. Now let us look at how blood collected from blood transfusions are used. Blood, or the components of blood, are used to treat patients with medical conditions such as anemia, cancer, blood disorders, and those having surgery. Around 2/3 of the blood donated in England is used to treat medical conditions including anemia, cancer, and blood disorders, and nearly 1/3 is used in surgery and emergencies including childbirth. Usage varies between hospitals depending on their particular specialties. The demand for blood from hospitals has fallen due to increased efficiency, but new donors are always needed to make sure there is enough blood to treat those who need it. Blood can be vital for people with medical conditions or who are having surgery, but blood transfusions can also improve the quality of life for people whose illness has no cure. Sometimes blood may not be suitable for transfusion. This blood can still benefit patients in areas like the development of treatments and therapies in research. Blood can also be very useful in research and training and to help develop tests. So hopefully you've gained a brief insight into the availability and usage of blood from blood transfusions. And now on to Adrian, who will be discussing problems and dangers of the current blood donation system.
So far, we have discussed how blood donations can do a lot of good. Donating just 1 pint of blood can save multiple people's lives. However, the blood donating process itself poses some minor risks to the blood donor. Before blood is taken from a donor, they are given a quick physical examination to check if they are susceptible to major side effects, but minor side effects can still occur. These include bruising, continued bleeding, dizziness, pain, and physical weakness. When donating blood, a healthcare provider will insert a sterile needle, usually on the inside of the elbow, that is connected to a blood bag, and the needle is kept there for about 10 minutes. When the needle pricks the vein, bruising will most likely occur around the site where the needle was inserted. After donating blood, the healthcare worker will wrap the arm in a dressing, and the pressure is supposed to help stop the blood flow out of the vein. And donors are instructed to keep the bandage in place for about 5 hours. In some people, bleeding will still continue after these 5 hours, in which case the donor should keep their arm above their heart and apply pressure on the needle site. In rare cases, bleeding will still not stop, and so the donor will have to see their doctor. After donation, a donor is kept in an observation room for about 15 minutes, as this is usually a sufficient window for many major adverse side effects and reactions to develop. Many people will feel weaker after blood donation, and some will experience nausea and dizziness, and if these symptoms do not go after several hours, the donor should call their blood donation centre. Issues with blood donation are not limited to the side effects that the donor experiences after donating blood. There are also issues with the whole system of blood donation that need to be addressed to make the system of blood donations as effective as possible. The first is a lack of donors' ability to donate blood. There's always been a demand for blood to be used in the treatment of other patients, research, and other methods and treatments that can be used to improve patient quality of life. Waiting times get longer as less blood is donated. This issue is partly resolved through investment in organisations that reach out to the community, such as school visits and leaflets, to make people more aware of the truth of blood donation. Some people may not be aware of how easy it is to donate blood, whilst others may be afraid of donating blood after reading something false. There are 3 types of blood donor: voluntarily unpaid, family or replacement, and paid donors. The first category is the one that is most beneficial to the NHS, whilst the third is not viable for further promotion, given how stretched the NHS is for money. Models suggest that, although blood suppliers are seeing short-term reduction in blood demand as a result of initiatives in patient blood management, meaning that less blood is wasted, blood demand will increase again, especially in developed countries around the world, to meet the demands of aging populations. Increasing the blood supply raises several challenges, including the recruitment of staff and retaining blood donors to ensure that they donate regularly. It is hoped that the development of treatments for conditions treated with blood transfusions will reduce the need for blood transfusion in the future. This brings us nicely onto the efficiency of use of donated blood. New figures show that almost 40,000 units of donated blood were wasted in Northern Ireland in 5 years, and this figure scales based on population to different countries of similar economic development, so you can imagine just how much blood was wasted in the UK. Blood is considered wasted when it cannot be transfused for patients for reasons such as improper storage, and cannot be used for research or other purposes, and as such is thrown away. Also, some types of blood are more common than others, and it is important to keep a supply of all blood types available in case of emergency. It may be harder to maintain a safe supply of rarer blood types for a long time, and so it's incredibly important to be efficient. Blood has a limited shelf life. Blood can last about 42 days when stored at 6 degrees Celsius in its compounded, unseparated form. So if lots of donors turn up at once to donate blood, then it won't do much good in the long term. An example of this is the amount of blood donated in the aftermath of 9/11. 475,000 units were donated, for the relatively small 258 units that were needed to treat the hospitalized survivors. Much of this excess blood donation was used to treat other patients in other hospitals all around the States, but a sizable portion of it was destroyed. Lots of unused blood can also be used for research, which helps to reduce waste as the blood is not directly treated as medical waste and incinerated. Thus, a challenge in blood donation lies in collecting the blood at quantities sufficient to meet current needs, whilst not being too much in excess that it has to be destroyed. This highlights the importance of regular donors, rather than donations after a particular catastrophic event. Another barrier to blood donation is the transmission of infection through blood transfusions from donor to patient, as has been touched on before. The WHO recommends that all blood donations should be screened for infections prior to use, to eliminate the risk of disease transmission through blood transfusions. Currently, screening for HIV, hepatitis B and C, and syphilis is mandatory, and other conditions can be screened for depending on the blood quality system and requirements in the country. The ease of disease transmission between donor and patient through blood transfusion highlights the importance of high blood safety and quality standards. Rather than finding out that the blood is not safe for use after drawing it, some donors may be turned away before the blood is taken. This limits the number of donors that are available, of which only a few will actually donate blood. So now I've talked about some of the issues and problems surrounding blood donation. I'll now hand back to Anupam to wrap up today's episode.
Hopefully today's episode has given you a greater insight into the way blood is used in our medical system, how it's collected, and how it's given to patients who so desperately need it. And maybe it's even inspired you to maybe give blood one day, so make sure that you meet all the criteria required to do so. As always, thank you for watching today's episode of Medisodes. We upload every week, every Friday, and we hope you tune in next week. In the meantime, remember to like, comment, subscribe, and share the channel to any of your friends or family who might be interested. Thank you for watching.